This is an instructional video on how to document TTO medications for patients who are going home. When you have entered PowerChart, firstly ensure that you have the correct patient here at the top. Within your doctor's view, you'll be able to see different tabs. At present, this is selected on admission. However, there's a tab called TTO meds here. You may also find these tabs maybe along the top instead of as a drop-down menu. Once you are selected on the TTO medications, you will navigate to the discharge status here, and this will pull up a window for you to be able to start the discharge reconciliation of medications. So there are different meanings for each of these medications. So the scroll denotes a medication that the patient was admitted in on, essentially a medication from their drug history. The hospital icon denotes a medication that has been prescribed as an inpatient. This pillbox icon denotes a prescription for patients to go home with. The stop symbol denotes a medication has been stopped and not to be restarted at the point of discharge. This play button here, this column, does not need to be used at any point. As we select the medications that we wish to start on discharge, we can select in the middle column and it will pull the medication over to the TTO. If there are any medications that you do not wish to continue at that point of discharge, for example, here, this will come up as discontinued and it will appear on the final discharge document as having been stopped. Please bear in mind that there will be some orders on this side that do not need to continue on discharge. For example, there may be continuous infusions or inpatient when required medications. If at this point you decide you would like to start something for the patient to go home with, you can add this by selecting this and search for an item here. And once you've selected it, you can click Done in the bottom right, and this will have added this medication as a discharge prescription. The blue circles with the white crosses denote that there's information missing before you can sign off the prescription. You'll be guided to the yellow boxes in each medication to tell you what is missing. So, for example, the Senna in this scenario is not an admission medication. As per our trust policy, we usually issue 28-day supply as standard. If you'd like the GP to review, you can add in comments here. If there are any comments for pharmacy, you can add it in here. And if there are any other further order comments that you may want to add for the GP, this can also be added in here. As we scroll down, we'll have to complete whether each item was an admission medication or not, so that it will pull this information onto the final discharge document. For items that are prescribed on a TTO, a supply assessment will be done by a member of the pharmacy team at the point of screening the TTO as well. If you know a patient has their own supply of medications, you can tick off this box here. For controlled drugs, you will be asked to write the total quantity in words and in figures. As you can see from this column, these are all the medications that the patient has been prescribed to take home on their TTO. Once you are happy with the medications that have been prescribed, you can sign in the bottom right corner. As you can see, this has come up with an action point whereby any new medications will need an indication to be completed before signing off the TTO. This can be completed by using the indication field in the details section. Once you have completed your discharge prescription, you can assign the add orders for medication to discharge, and this will fire a task for the pharmacy team and the pharmacist to review the TTO. If you are not completing the TTO at this point in time, you can untick this box so that it will not go to the pharmacy team for processing. Once you have made your selection, you can select OK. If there are any special instructions, for example, then you can add that in, and this will also go across to the pharmacy team. Select Sign at the bottom here, and that is how you have completed your discharge TTO. If you have any further questions, you can access a QRG, a quick reference guide, using the eCoach symbol at the top, or you can speak to your ward pharmacist or a member of the digital team.